Okay. Okay, we're going to begin our press briefing for this afternoon, Monday, April 20th, 2020. I'm Peter Zanoni, Corpus Christi City Manager. And joining me today for our joint City Nueces County briefing will be Annette Rodriguez, our Director of Public Health. Dr. Ramachandruni, our local health authority, is here as well this afternoon. And then Nueces County Judge Barbara Canales is also here to take part in the press briefing. What I will talk about is our statistics, to talk about the number of COVID cases since yesterday. We report every day. Today I am going to begin a conversation on one death that's taken place in Nueces County. And then I'll give you a quick update on our LIFT fund, that small business recovery program that City Council approved 2 weeks ago, where we wanted to put some additional resources in that fund since it's turning out to be very popular. Annette Rodriguez will talk to you about our drive-through collection that took place this morning, and as well talk about the next collections activity or event. And then she'll talk a little bit about that first death as well, COVID-related death. And then Judge Canales is going to talk about some additional orders that she's going to be recommending to Commissioners Court this week, and subsequently City Council will consider tomorrow. So with that, did you want to do a translation, or you want me to keep going?
I can do a quick one.
Okay.
Muy buenas tardes. Hoy quiero agradecerles por estar aquí hoy. Mi nombre es Peter Zanoni, soy administrador de la ciudad. Hoy vamos a dar unos datos sobre el condado de Nueces y la ciudad de Corpus Christi. También vamos a hablar sobre una muerte relacionada sobre el virus en el condado de Nueces County. Y también la directora del distrito público va a hablar sobre nuestro autocolección y también va a hablar sobre los materiales que necesitan para los exámenes del COVID. Y el condado de Nueces, la Bárbara Canales, nos va a hablar sobre unos datos que van a ser sobre los órdenes del condado.
Okay, thank you. Okay, so I'm going to provide you an update now on our COVID cases. So every day at 4 o'clock, we take a snapshot of what's happened for the past 24 hours. And even with today's drive-through testing that took place this morning, and subsequently 20 tests were analyzed in our laboratory, we have 0 additional cases to report since yesterday. And in fact, yesterday we had 0 as well. So as of today, we're still at 90 cases in total. So 0 from today. We did 20 tests in our laboratories, and we received from hospitals 101 tests that have been performed over the past couple of days, most likely. So in total, the amount of tests that we're analyzing in our labs or commercial labs is a little over 1,500. So that's probably about a 0.5% of all our population then has been tested. The number of deaths we have been reporting has been 0, and that changes today. So the first COVID-related death is being reported today, and I'll give a general overview, but we have health professionals that'll provide more information and help to answer questions. So the patient that died was a female between the ages of 70 and 79 and a resident of Robstown in Nueces County. She was admitted in March and tested positive for the coronavirus, but subsequently was discharged from the hospital after making some type of a recovery. Recently, she was readmitted for other complications, abdominal pain, and other issues. And she passed away yesterday. We're reporting it today because the hospital didn't connect the two with the prior COVID patient who readmitted under other complication wasn't considered to be a COVID patient under those admission statistics today, recently. So anyway, after getting everything organized, we are reporting this as a COVID-related death in Nueces County. The number of COVID cases of 90 is pretty evenly distributed between male, female. There's 46 males that have COVID-19 or have had it, and 44 females in Nueces County. And then the age group will continue to say the same message, which is that the COVID virus doesn't pick one age group over another. So even young persons are prone to getting the virus. In fact, every age group from the age of 20 to 79 has a fair number and almost an equal number of cases. When you look at those 90 cases, they're pretty much evenly distributed. There's 2 cases in the age bracket of 0 to 19 and 1 in the age bracket of 80 to 89. And let's talk about the locations. That's important for people. So Nueces County has Corpus Christi and a few other communities within the county. So of the 90, 75 are within the city of Corpus Christi, 2 are in Robstown, 7 persons with COVID are reported to be from Port Aransas, and then 6 are from rural Nueces County. And then let's look at a new slide we've been putting up to kind of put things in perspective. We know there's 90 cases, but we also know people are recovering. And so the total number of persons that have recovered to date since we've been tracking this is 14, as you can see in this chart here. So that means of the 90, 76 still have it, or in the one case, the one person passed away. In the hospital today is 5 persons currently in the hospital in Nueces County because of COVID-19, and one of those 5 is in intensive care. And so with that statistics, we're going to have a translation of Spanish, and then I'll continue on with one other item, and then we'll have Annette come up.
Por el momento todavía seguimos en el condado de Nueces con 90 casos confirmados de COVID-19. 40 son relacionados sobre viaje, 29 de persona a persona, 19 son comunidad de transmisión de comunidad y 2 solamente siguen en investigación. 14 personas se han mejorado y una persona ha sido relacionada con el COVID-19. El total de exámenes que se han administrado en el condado es 1,510.
Okay. Okay, and then the last point from my perspective is to talk about small business recovery. And so we know that the COVID-19 has caused an economic upheaval across the world, certainly, and it's impacting us here as well. And 2 weeks ago, though, City Council acted to help small businesses in terms of economic recovery. They approved $1.7 million in loan assistance to small businesses. And a small business for this program includes one that has gross revenues annually of 1.5 million or less. And a company has to have had a 15% decline in revenues since March 1 to be eligible for the program. The program is being administered through LIFT Fund, which is a lending institution that the city has had a business relationship for about 15 years. And the loan amounts are anywhere from $15,000 to $25,000 up to those amounts, depending on the business's shortfall and their desired loan amount that they want to take. So since 2 weeks ago, when LIFT Fund opened up the applications, we've received 250 applications in the queue, and it's actually a week ago Monday, so a week ago plus this beginning of this week. So 250 applications for a total value amount, if all were funded, of $5.7 million. So the 1.7 is oversubscribed, if you will, and so we recognized that last week and began to work to secure other dollars. We looked back at our Type A funding and have freed up a little more dollars there to be added to this program. Today, the Type A Board of Directors, which is a separate governing body appointed by the mayor and city council, allocated $2.5 million, $2.5 million to be sent to the general fund, basically, freeing up dollars there where we can direct general fund dollars to the program, so we can add another $2.1 million to the 1.7 that was already programmed by City Council, for a total of $3.8 million that would be available for small business assistance. So that'll go a long way with the great amount of requests that have come in. This last infusion of funds, though, does have to be considered by City Council tomorrow. So the Type A Board agreed to use monies today from the Type A Fund, but City Council tomorrow in their regularly scheduled meeting will consider that recommendation and vote as to whether or not to do that. So we'll keep you posted tomorrow of the outcome, either during the council meeting, certainly, or at this press briefing at 5 tomorrow, if somebody doesn't get to tune in then. Okay, so we're going to go for a translation on that, and then Annette Rodriguez, our Public Health Director, will come up after that.
El programa de recuperación de businesses pequeños han recibido más de 250 aplicaciones por un total de 1.7 millones de dólares. Más dinero ha sido apropiado para el programa de 2.1 millones de fondos tipo A. El total de fondos que van a ser disponibles van a ser 3.8. Mañana el Council va a estar teniendo una junta para poder apropiar esos recursos.
Thank you. Today's drive-through went very well. There were 19 specimens collected through the drive-through, and all tests were negative today.
Nosotros tuvimos 19 exámenes, muestras que fueron tomadas hoy en la mañana, y de esas 19, las 19 fueron negativas.
It saddens me to have to report the first coronavirus-related death in Nueces County resident. The Health District received confirmation of the first COVID-19 related death in Nueces County. The patient tested positive for COVID-19 in early March, but subsequently tested negative prior to being discharged from the hospital at the end of March. The patient was a female between the ages of 70 and 79, and the patient was recently readmitted for complaints of abdominal pain and other underlying issues. The patient subsequently passed away April 19th, 2020. Our condolences go out to the family and friends of the deceased. The Health District remains vigilant in their efforts to contain and mitigate the spread of the coronavirus and to do all that we can to protect the community, especially the most vulnerable populations. Although this patient had tested negative prior to being released from the hospital, COVID-19 is a new disease, and there is limited information regarding risk factors to severe disease and subsequent complications. Based on current available information and clinical expertise, older adults and people of any age who have serious underlying medical conditions might be at higher risk for severe illness from COVID-19. In Nueces County, there are 90 confirmed cases. In Texas, there are 19,458 confirmed cases. As the number of cases of COVID-19 increases, the Health District continues to appeal to the general population to stay at home as much as possible. Practice social distancing by staying at least 6 feet away from others, and continue to wash your hands with soap and water for at least 20 seconds. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Always cover your sneeze or cough, and if you are sick, stay at home. Wear a face mask covering when going out, especially in areas of high traffic such as grocery shopping or pharmacy. For more information on the coronavirus, please visit www.cctexas.com/coronavirus. Thank you.
Con mucha tristeza se reporta hoy que tuvimos la primera confirmación de una muerte relacionada con el COVID-19 en un residente de Nueces County. La persona era una mujer de edad de 70 a 79. Esta mujer fue admitida al hospital y fue dejada de alta después de haber recibido un resultado negativo de COVID. Subsecuentemente, la persona se quejó de ciertas complicaciones de dolores abdominales y fue readmitida al hospital. El paciente murió abril 19 de 2020. Nuestras condolencias para la familia y para los amigos de esta persona. El Departamento de Salud sigue recomendando que sigan los protocolos de prevención, lavarse las manos con jabón y agua, no tocarse los ojos, la nariz y la boca y distanciarse por lo menos 6 pies.
Thank you. Good afternoon. Barbara Canales, Nueces County Judge. This afternoon, I want to focus my attention on an order that was just signed by me just a little while ago. Today, this order aligns Nueces County's emergency orders, which are you know, as stay-at-home orders with Governor Abbott's emergency orders that he issued on Friday, April 17th, 2020. Governor Abbott's executive orders begin the process of reopening the state of Texas in phases while revising hospital capacity and certain social distancing guidelines. And today, we're mirroring those in Nueces County. My orders cover two categories, and I'm going to discuss that in the order that they will take effect. The first one has to do with hospital capacity, surgery, and procedures. And the first part of the order aligns Nueces County with Governor Abbott's GA 15 order. And this, of course, is relating to hospital capacity and personnel protective equipment. We now know that to be called PPE. And of course, that's very important because it's needed in our COVID-19 response. The order lessens the restrictions on surgeries put in place by Governor Abbott's order in March that we all know is the GA-9, and beginning at 11:59 on April 21st through 11:59 May 8th, all licensed healthcare professionals and all licensed healthcare facilities must continue to postpone surgeries that are not medically necessary to diagnose or correct a serious medical condition or preserve life without timely performance. Okay, that's all that had in there. But now there are exceptions, and those are any procedure that if performed in accordance with the commonly accepted standard of clinical practice would not deplete the hospital capacity or PPE, and any surgery or procedure performed in a licensed healthcare facility that has certified in writing to the Texas Health and Human Services that it will reserve at least 25% of the hospital capacity, and that it will not request any PPE from any public source. Okay, so that's me reading it verbatim. Now let me explain it. So much easier when you can just talk to people. So what's happened here is that on Friday, when the governor when he issued his order, he eased up the restrictions that previously had been in place for no elective surgeries to take place in our hospitals. Remember, why he did that was to make certain that we had capacity in our hospitals and we could conserve the PPE, that very vital personal protective equipment. We now have caught up with our ability to provide PPE to the hospitals, and he says now that we can have these elective surgeries as long as we do two things: reserve 25% of hospital capacity and reserve 25% of PPE. So it's good news for our community because it means that those important surgeries that need to take place that may not have been life-saving, but they're still important surgeries, that we're going to get back to the business of taking care of all kinds of healthcare procedures in our community. So that's a big change, and it's phase one. And on Friday, there'll be another update. This Friday, April 27th, there'll be another update. And so we'll be able to bring you back more information. But I have always trended when the governor has had an order to make certain that Nueces County conforms to that order if it's in the best interest, and I do believe it is. The second part of the order, and again, I'd like to give you the information and then we'll do the quick synopsis. The second part of my order aligns Nueces County with the governor's GA 16 order, and this relates to the safe strategic reopening of selective services and activities in Texas. And this order establishes a temporary retail-to-go model that will allow retail outlets in Texas to reopen beginning Friday, April 24th. Now, that's this coming Friday. Under this model, reopened establishments are required to deliver items to customers' cars, homes, and other locations to minimize contact. So we're still very much protecting the public health and safety, but we're opening up businesses in a very orderly and a very important way, and that's under this retail-to-go model. The reopened services will start at 12:01 a.m. Friday, April 24th. And these are really directed at the not essential services. Remember how we had that big discussion of what's essential and what's not essential? So this is helping those businesses that were not essential, and now they're going to have the opportunity to provide this retail to go, delivering to your car, to your home. Very, very good as far as phasing our businesses back into operation. Of course, you can always have delivery by mail and to the doorstep, and there's many ways to implement this new retail to-go policy. I believe that all of the orders will be on the website. If they're not on right this minute, it's because we just signed them, but they will be on there by this evening. We have given the opportunity for other electeds in our county to understand what these orders mean, and we even share them within the region so that other counties around us can also mimic what we're doing, so we can create seamless transitions as we now begin to look at ways that we can reopen Texas business in a safe way. These are two ways that have been identified by the governor, and now here in Nueces County, we're also going to follow suit. I just want to make a quick comment about the opportunity that lies before us as we reopen in these phases business, and that is to continue the social responsibility that we've asked you to do almost a month before. We have been in social distance practicing now for weeks and weeks. We have probably grown tired of being stuck in our homes. I can see that through the emails that I'm receiving, there's a little bit of what we used to call, ants in your pants. People want to get out, right? They want to be in the parks and on the beaches. And I just want to let everybody know I empathize with you. Truly, I do. It was an incredibly, most magnificent, gorgeous evening. And as I looked over to the beautiful sunset, I also looked over to a very busy Swantner Park. And when I opened my iPad this morning at 8 o'clock at the office, I also saw that I received emails from Bob Hall Pier and people who are, watching our beaches closely. Please, I really want to implore you, as we come into this new phase, help us do the best thing we can, which is to mitigate the spread of this virus. One of the best pieces of news is that it appears that we are definitely increasing our testing. We're getting the materials that we need. We're going to continue to make sure anybody who meets the criteria gets the tests that they need. We want to be able to celebrate when we have 0 new cases in our community. And we also need to remember to mourn when we have our first COVID-related death. There truly is a season to all things. And today we celebrate both the life of a lady that lived amongst us here in Nueces County, and because of this insidious disease, had a related death. And I want to express my condolences to her family and to the community at large. When we lose one, a little piece of us is lost as well. And so I just want to reaffirm that all of the measures we're taking are to save lives, and that life still remains the most important factor in all of our decision making. So as we come into this new normal with these new orders and more to come, let's keep remembering that the best thing we can do is to continue that social distance. And I look forward to coming. Actually, I think I'll be back with you tomorrow. I noticed that all of us, when we're coming and going, we're starting to wear those masks. And we're going to have a robust discussion in Commissioner's Court about mask wearing. And I will tell you that we are going to have this discussion because as we begin to open businesses, we need to begin to think about new ways we can continue to mitigate the spread of this virus. It only takes one time for this virus to come in and infect an area that's vulnerable, to create devastation and havoc and tragedy. And I know none of us want that. So we're going to have a good discussion about the proper places to maybe think about as we reopen business where masks can be used to mitigate the spread of disease. So I look forward to updating you about that tomorrow. And again, I know it's probably not an order that probably needs too much more explanation, but if you have any questions, particularly about the retail to go, 414-6000 or county.attorney@nuecesco.com. And we will be happy to continue to answer your questions. But remember, on retail to go, you're still not opening your business. You're able to do your non-essential business in a new way that continues to promote health and safety. Thank you so much.
O quiero enfocarme en las órdenes que se acaban de aprobar. Las órdenes se reflejan con las órdenes del gobernador de Texas. Una de las órdenes baja las restricciones en cirugías. Las cirugías podrán continuar mientras los protocolos de prevención sigan en paso. Por lo menos 25% del equipo de protección personal tienen que estar siguiendo disponibles. El viernes más información va a salir. La segunda orden ofrece la habilidad de tiendas con la posibilidad de dar servicios y cosas en una forma que no hagan contacto. Seguimos buscando formas de abrir nuestra economía, pero en una forma segura. Buenas noticias, seguimos incrementando el número de exámenes que han sido... Seguimos incrementando el número de exámenes y recibimos un rebaje en los casos positivos. Estas son buenas noticias. Por favor, seguir las prevenciones y los protocolos de prevención.
Okay, great. Okay, that concludes our prepared remarks for today's joint city and Nueces County briefing. We're here to answer any questions, and I want to remind you our local health official, Dr. Ramachandruni, is here as well. So with that, we'll see if there's any questions. Courtney? Okay.
How was it officially determined that this person's death was related to COVID-19?
Okay, let me have either Annette or Dr. Ram. You might want to repeat the question to Annette so they can.
So the question was, how was it officially noted that it was a COVID-related death? So we reached out to the Department of State Health Services today, and since the patient was initially a COVID-19 positive patient, the determination was made that while the cause of death may not have been COVID-19, it was still a related COVID-19 death.
Annette, I have a question. Can you talk about her? Was she a home health care provider or in the area?
Was she what?
Was she a home health care provider in the area?
Oh, okay. The question is, was she a home health care provider in the area? And the answer to that is no, she was not. She was retired.
Okay. Also, too, on a different subject, the weather is starting to change. We're starting to see these 90-degree temperatures. Will that affect the disease? I mean, the coronavirus?
Okay. So the question is, with the weather changing and it's starting to feel like 90, 100 degrees outside, will that affect the COVID-19? We hope so. We don't really know because the disease is so new still, and so we don't know that answer yet, but we're hoping that it will and that, we'll see a lot less cases.
But still, people need to be vigilant.
If people still need to be vigilant, the answer is yes. You still need to practice that behavior that we've been repeating over and over again, because again, we don't know what the disease is going to do, and we want to mitigate it as much as possible.
How many people were tested again today, and how are you doing on supplies?
We're doing pretty good on supplies, thank you. The question was, how are we doing on supplies and how many people were tested? So we tested 19 through the drive-through, and we tested 1 through the hospital system, so a total of 20 people were tested. All of them were negative at this time, and for supplies, we're doing very well, I think. We've gotten some nucleic acid kits from the state, and so we have around 300 at this point, and we're also getting some collection kits as well, and so that's really exciting to us because we need more so we can test more. Thank you.
I just want to add to that statement to qualify it that the only reason we're doing good is because the judge, myself, the mayor, did a legislative call to our legislative delegation. That includes our senators and our House of Representative folks, to have them help us get supplies. Last week at this time, we're down to 30 or so test supplies that would allow us to do 30 tests. Had we not made that call and put that pressure on to get help, to get us supplies down there, we wouldn't have tested too many more beyond today. So the supply issue, the national testing situation is could be argued issue number one in helping to solve this pandemic. And we can only test to the extent that we have supplies. We can still test locally if we don't have them, and then we have to ship the specimen off to places like Austin, which still gets you a test result, but it takes days, several days. So we're doing good now that we got some materials in with the help of County Judge Barbara Canales, Mayor McComb, and myself that placed a last-ditch call to our legislative delegation. And we thank them because we believe their intervention was what mattered. So we want to thank them. Any other questions? Okay. With no other questions, then we'll see you tomorrow. As the county judge said, she has a workshop at the county courthouse tomorrow.
Well, it was changed, we're going to do it on Wednesday.
Wednesday, okay.
It's part of the,
Okay.
in the morning.
Okay, very good. Okay, so the Commissioners Court, well, let me start with tomorrow. The city has a city council meeting tomorrow where Mayor McComb may discuss with city council some additional orders to be a companion or to be reflective of what the county may consider doing. And then Wednesday at Commissioners Court, there'll be a workshop with respect to some additional orders. And then you have a Commissioners Court meeting as well, Judge, right, on Wednesday? Yeah, followed by a meeting of the Commissioners Court on Wednesday. So we'll be at council tomorrow. We'll be here again at 5 with County Judge Canales, and Mayor Joe McComb will be here as well tomorrow at 5. And then Wednesday will be some activity at the Commissioners Court, work session and meeting, and then we'll be here at 5 as well to report out anything from that. Okay, we'll see you all tomorrow. Thank you.